Are they prone to hip dysplasia? Hip dysplasia is a common orthopedic condition that affects many individuals, including both humans and animals. In this video, we will discuss whether certain groups of individuals, particularly dogs, are prone to hip dysplasia and the potential risk factors involved. Hip dysplasia is a condition characterized by an abnormal development of the hip joint. This can result in a loose and unstable joint, leading to wear and tear and, in some cases, osteoarthritis. It is a hereditary disease that can be affected by environmental factors as well. When it comes to dogs, certain breeds are indeed more prone to hip dysplasia than others. Large and giant breeds, such as German Shepherds, Labrador Retrievers, Golden Retrievers, and Rottweilers, are commonly associated with a higher risk of hip dysplasia. This is due to their genetic predisposition and the physical demands placed on their joints due to their size. The exact hereditary factors that contribute to the development of hip dysplasia are not fully understood. However, it is thought to involve a combination of genetics, growth rate, and environmental factors such as excessive weight gain, improper nutrition, and excessive exercise during the developmental stages. Hip dysplasia is generally more common in purebred dogs compared to mixed breeds. This is because purebred dogs have a more limited gene pool, which can increase the likelihood of inheriting certain genetic conditions. Mixed breed dogs, on the other hand, tend to have a wider genetic diversity, which may help reduce the risk of developing hereditary diseases like hip dysplasia. While genetics play a significant role in the development of hip dysplasia, other factors can also contribute to the severity of the disease. For example, obesity is a common risk factor for hip dysplasia. Excess weight puts additional stress on the joints, increasing the likelihood of developing joint problems, including hip dysplasia. Additionally, environmental factors during the developmental stages can also impact the development of hip dysplasia. Puppies that are subjected to excessive exercise or placed on slippery surfaces too early in life may experience increased strain on their growing joints, potentially leading to hip dysplasia. The symptoms of hip dysplasia in dogs can vary, but common signs include lameness, difficulty rising or walking, decreased activity, and a noticeable decrease in muscle mass around the hip area. If you suspect your dog may be suffering from hip dysplasia, it is important to consult with a veterinarian for a proper diagnosis and treatment plan. So, what can be done to prevent or manage hip dysplasia in dogs? While it is impossible to completely eliminate the risk of developing hip dysplasia, there are certain measures that can help reduce the chances or manage the condition effectively. Regular veterinary checkups are crucial for early detection and intervention. If a dog is diagnosed with hip dysplasia, treatment options such as weight management, exercise modification, physical therapy, and medication can help manage pain, slow down the progression of the disease, and improve the dog's quality of life. Proper nutrition is also vital for the overall joint health of dogs. Feeding a balanced diet, avoiding excessive weight gain, and providing joint supplements that contain glucosamine and chondroitin sulfate may help support joint function and reduce the risk of developing hip dysplasia. Furthermore, responsible breeding practices can significantly reduce the prevalence of hip dysplasia in certain breeds. Breeding dogs that are free from hip dysplasia or have low hip scores can help decrease the likelihood of passing on the condition to future generations. In conclusion, certain breeds of dogs are indeed more prone to hip dysplasia, particularly large and giant breeds. While genetics play a significant role in the development of this condition, other factors such as obesity and environmental factors can also contribute to the severity of hip dysplasia. By implementing preventative measures such as regular veterinary checkups, proper nutrition, and responsible breeding practices, we can help reduce the prevalence and impact of hip dysplasia in dogs.